In today's video, I'm going to be talking to Dr. Hrishi Belani and Dr. Karina Celaya about the impact of alcohol on women's health. Hi, I'm Nadia, and I'm part of the team here at Sunnyside and resident mindful mixologist. Sunnyside is the only alcohol tracking, planning, and coaching app that's all about mindfulness and moderation and not about sobriety. We've helped countless people build a healthier relationship with alcohol without ever pressuring them to quit. Check out our website for a free 15-day trial if you're interested. In today's conversation, we'll be discussing how alcohol impacts women's libido, hormonal changes, reproductive health, and much more. But before we jump in, here's what you need to know about our guests. Dr. Hrishi Belani is Assistant Clinical Professor of Medicine at UCLA and Associate Medical Director of the South Los Angeles Health Center Group. Hrishi is trained in internal medicine and is a primary care provider focusing on patients with substance use disorders as well as patients living with HIV. Hrishi has a background in drug use and public health, and before medicine worked at the CDC to help countries curb dual epidemics of injection drug use and HIV. We will also be speaking with Dr. Karina Celaya, a board-certified OBGYN who works for the Department of Health Services in Los Angeles County at the Hubert Humphrey Comprehensive Health Center. She's an assistant professor in the Department of OBGYN at Harbor UCLA Medical Center and works to coordinate care across LA County. She is particularly interested in public health principles to optimize healthcare delivery and reduce health disparities in women's health. Let's jump into the conversation. So much for hopping on this call today. I'm really excited to get to learn a little bit more about the impact of alcohol, specifically on women's health. I know that there's a lot of questions we get asked as well about, the difference between the impact alcohol has on both men and women. So really looking forward to jumping in and learning from some experts that can speak a little bit better to this. It would be great to understand a little bit how you guys got into your respective fields.
I think my introduction to the field is very similar to Dr. Belani's. I worked in public health for several years before med school. And then once I got into medicine, I realized that I loved working with women throughout their whole lifespan. So it's awesome to be able to get to see them from adolescence and their pregnancy and then their perimenopausal to menopausal state. So the whole life cycle was really great. And now I have an opportunity to use public health to influence the healthcare delivery system of these women. So it's a nice little mixture of both. So yeah, that's how I came about, and that's how I work where I work.
Yeah, and similar for me, after college, I went and had a career in public health. I worked at the CDC. I was kind of stationed in Atlanta, but used to travel to East Africa to look for populations of injection drug users and help those countries prevent HIV spread amongst those groups. And so I was kind of always had this dual interest in both substance use disorders and HIV. And, I thought maybe I would become like the drug czar for the United States, but instead of that, I really decided medicine was for me. And so when I became a physician, I now get to focus on working with patients who are living with HIV and working with patients who have a substance use disorder and alcohol use disorder. The nice thing, like we have a lot of ability here in LA County to work on the public health level. So not just thinking about patients with disorders or dependence, but also just thinking about general preventive health, focusing on healthy habits and living healthy lives.
Well, I think we can say without a doubt that we are among the right experts here for today's topic, which we're going to talk about alcohol health, specifically how it impacts women. I think one of the first questions is maybe we can jump in generally and speak a little bit about what you guys have noticed in terms of alcohol's influence on women versus men. Like, is there a real difference there?
Generally, there seems to be some small differences between alcohol effect on females and males. Some of them are physiologic, some of them are psychosocial and kind of societal. When we think about how women, or I guess cis women or trans men metabolize alcohol, there are some differences based on enzyme levels in gut tissue. And so we tend to see females metabolizing alcohol in a different way that might lead to faster intoxication, higher blood alcohol levels. Along with that, there tends to be, in the setting of excessive alcohol use, there tends to be higher risk of alcohol-related organ damage or disease. And so in women who use alcohol excessively or have alcohol use disorder, we can see more heart disease, stroke, liver disease related to alcohol. And on the psychosocial side, unfortunately do see different rates of assault, unwanted pregnancy, unprotected sex that tend to affect females more than males. And also higher rates of suicide and other alcohol-related accidents.
Is there a direct impact from drinking on libido, and is it really positive, or are there some other things that we should be concerned about for women's libido and just sex in general?
Right. So just to clarify, libido is really the overall sex drive and the level of desire that a woman may have. And there are a lot of factors that go into it. And I know there's some thoughts that low dose may be a little disinhibiting for patients or for women in general. But we do know that there is a slight euphoria with like low dose that we've seen in some studies. But then there's like an opposite effect once you get to moderate to heavy drinking. And because alcohol works to suppress the nervous system. So what that does is that it makes us slow down our brain function, our breathing decreases, and also blood flow. So sometimes women will have, in these moderate to heavy levels of drinking, decreased vaginal lubrication, for instance, which can affect libido in some regards. So it's a mixed picture. There are some associations, but mostly it's to the negative effect, which is contrary to what we think about in the media. What we want to be is just like mindful, like having that mindfulness about how we drink and when we drink.
Great. And I know one of the other things that we were discussing before is hormonal change in menstruation. How does increased alcohol consumption interfere with our ability to produce the right types of hormones?
Right, that's a great question. And we know that alcohol has been associated with irregular menses. So that can be different for every person. We do have some studies on infertility patients that showed some ovulatory dysfunction, meaning that your ovaries aren't ovulating like they should, and which can lead to irregular menses. So it's kind of like a cycle. So those are some of the causes. We also see some women with alcohol not have a period at all. One of those things to consider that it can affect women differently, and it can affect women who are on birth control or some hormonal at baseline. So that may also be a little bit different in how their menstruation may be.
Does somebody need to be drinking really consistently over a long span of time, or is it even just a short period of time that can have an impact here?
Yeah, I think a lot of these studies were retrospective, and so they're asking people back, a couple months ago, how much are you drinking and what? So we don't really have a really good understanding. And to Dr. Belani's point, like every woman is different, right? So their rates of metabolism may be different than others, and so it can be very different for each individual. But typically what we see for those studies are more moderate to heavy drinking and over a longer period of time.
And Hrishi, this might be a question for you, but speaking to the impact of alcohol and how quickly it takes alcohol to kind of negatively impact your ability to make decisions, do you have anything to add to that or say to that?
Yeah, I think that's a good point too. And I think we always think about it like in terms of acute and chronic. So when we just talk about your regular evening out or, episode where you might be drinking, it just depends on your body situation that day, and for most people, a few drinks in will start to get the blood alcohol levels high enough that it'll start to alter your kind of cognition, delay some of your decision making, make you a little bit slow. And so that's that kind of early intoxication feeling. For the most part, that's normal, and it can be not too toxic or harmful, but those are the kinds of the times where we say, make sure you're in a safe surrounding, make sure you're not operating, machinery, driving, things like that. And beyond that, if you're drinking more drinks, binging, you can reach the level of blackout or unconsciousness depending on how much alcohol you've consumed and how fast your body can metabolize it. Thinking about long-term use, really episodic use shouldn't lead to kind of long-term neurocognitive decline or function change, but some people do tend to have different changes in the body that would maybe affect how their brain works, how their nervous system works. And so we can see that with regards to, changes in your vitamin levels that can lead to nerve damage, which can change the way you kind of walk, your balance. And then definitely you can get some levels of brain fog from excessive drinking over time, which depending on, there are different kind of multifactorial causes for that, but it could be related to just being kind of drunk all the time, to being malnourished, and then to delayed kind of brain growth or functioning or regeneration, which then leads to slowed thinking and decision making changes, what we call executive function.
And then for women who are looking to get pregnant, I guess this is a two-part question, but if somebody's planning on getting pregnant, we know that no pregnant women should drink at all. Like, what about that initial state of being in the preparation of pregnancy? How does alcohol come into play there?
I think that's a great question. As you know, more than half of our pregnancies in the United States were unintended and unplanned, which leads to where I usually typically see my patients with this question, right? So most people don't even know that they're pregnant in 6 to 8 weeks into it, because it can affect your irregular cycles. And so people may not know that they're pregnant. And this is where most of the development takes place. And so I commonly see a lot of my patients say, oh my gosh, I didn't know I was pregnant. I was binge drinking. Like, what effect does this have? And thankfully, the rates of something very serious called fetal alcohol syndrome is very rare. It's less than 1% in the US. But there are a lot of disorders that can happen in, once the baby's born, like neurodevelopment, behavioral, impaired function that can occur. That's a little bit more common than that. And so for people that are planning, the other half that are still thinking about, like, I want to get pregnant, we always say, like, it's good to just decrease your amount of drinking. If you're actively trying to get pregnant, then let's try to not drink at all, because pregnancy can occur pretty quickly for most people, and you just want to be able to not have that risk if possible.
So on that note, once somebody is pregnant, we know that they shouldn't drink during their pregnancy, but then post-pregnancy, when breastfeeding, how soon again can a woman start drinking after giving birth?
So really once breastfeeding is established, which is different for everyone, but usually around the 3rd or 4th month, there's recommendations that if you want to have a drink, you should wait a few hours after drinking to start breastfeeding. So they recommend anywhere between 3 or 4 hours after drinking is probably safe, so that the baby doesn't have any of the alcohol in the system. And they also have these test strips that you can buy that can check alcohol levels in the breast milk as well.
So you don't actually have to totally stop drinking if you're breastfeeding.
You just have to think about the timing of it, right? So
being more mindful about your consumption.
Absolutely. I think it's pretty fair to plan it out that way.
I was just going to say, mindfulness and planning is always a good idea.
And we'll link to Sunnyside in the description after this for anyone who wants to track their drinks a little bit more consistently. Let's transition a little bit into the level of dependency. Now, have you noticed any dependence between genders?
Yeah, it's pretty well studied difference. There are definitely lots of kind of National Institutes of Health studies looking at these differences. While dependence is more common amongst men, it's actually equally likely in women, but it tends to be more common amongst men. And as we talked before, there are some kind of differences in how dependence affects women. And so they tend to have more serious health complications from having dependence or use disorders, and more serious psychosocial negative outcomes. And then there's also studies that show that females tend to be at higher risk for relapse and craving than men. Anecdotally, in my practice, I tend to have pretty equal success in patients reaching, their goals in terms of consumption. But on the whole, I think it is easier for men, or we see it more often in men, that they have longer periods of abstinence when they're aiming for abstinence, and women or females tend to have more risk of relapse.
So, Karina, do you notice as an OBGYN any signs that somebody isn't drinking mindfully? Like, are there any early warning signs that women can look out for themselves?
Yeah. I think mostly what I see is risky sexual behaviors. So I have patients that will say, I just blacked out. I don't remember what happened. I don't remember who I had sex with. I'm concerned that I might have a sexually transmitted infection. So those type of situations are very similar, like what people come and describe their experiences with. And that's when we kind of delve into a little bit more about their psychosocial aspects of health. And we bring up alcohol as one of them, and other substances that they may use that may contribute to attenuation of that.
What are some of the other risks or additional risks for older women who are drinking a little bit more excessively? And what is some advice that you could maybe share with people who want to cut back?
From middle-aged to older women, I think there's a concern for an increased risk of breast cancer and those that have moderate to heavy drinking. And it's usually something that's been more chronic. It's not something that would have happened, in the last year or two. But that's something because we have an increased level of estrogen that happens when we drink too much. We have studies that show there's like up to a 41% increased risk of breast cancer. And this increase of breast cancer kind of goes along with the dose as well for alcohol. So it's just something to consider, making sure they're up to date with their mammograms, making sure they can modify their behaviors in a more healthy way, and being thoughtful about that with their drinking.
So Hrishi, since you have experience dealing with substance abuse, there's a lot of content coming out right now talking about CBD and marijuana to replace drinking. Is that a good way to manage your drinking patterns, or are there any other consequences associated with that as well?
Yeah, that's a great question. That's a really kind of hot topic right now with the kind of legalization of cannabis that's happening across different states. It's becoming more of an option or recreation of choice. I don't want to say vice of choice or drug of choice, but recreation of choice, because it is legal. I think definitely it's an interesting thought and kind of concept of saying, oh, if I want to reduce alcohol but still have a good time, I could use cannabis and not have the negative effects of alcohol. I think that definitely works for some people, but it has to be really done in moderation. I don't like the term kind of replacing one addiction for the other, because when it comes to addiction, we really don't want to have any addiction or any substance on board that might lead to negative consequences. And so when we think about like the California sober approach of I'm not going to drink alcohol as a recreational activity, but I'm going to use cannabis instead, I think for some people that can definitely be a fine option. And especially if you're doing it or kind of consuming legal cannabis, then you're pretty sure the source of where it comes from. You do have to remember that it's not legal federally, and so it's only in the states that it's legal where we should be consuming cannabis safely. And then really thinking about that replacement concept, that's the kind of when we get into this slippery slope of, if I'm overusing alcohol, can I use cannabis to now counter that and bring down my alcohol consumption? And then what we worry about is overuse of cannabis. And that also has risks attached to it. And so you can have paranoia, you can have vomiting, you can have declined cognitive function, so slowing in your thinking. That happens with cannabis. That can have a similar negative impact as drinking too much alcohol. If you are dealing with a substance use disorder, we tend not to recommend other substance use or continuing other substance use. And often what we find is when it comes to tobacco, when it comes to stimulants, along with alcohol, it's actually more effective to treat all of the use disorders at the same time while the motivation is there. And really focus on healthy living. So you really have to think about it different from moderating my drinking at normal healthy amount.
And if somebody wanted to be proactive with understanding some of the impact that alcohol is having, are there any proactive tests women can take just to make sure that they're staying healthy and not overdoing it with their alcohol consumption?
I'll give a plug for routine visits to your primary care provider or your women's health provider. Regular checkups, routine screening can identify or signals and signs of excessive alcohol use. And so when we check your cholesterol, when we check your blood counts, when we check your liver enzymes, we can start to see abnormalities that would prompt the question, how much do you drink?
I usually will ask a lot about psychosocial issues in health, because I think that obviously will affect their medical conditions. So I usually delve into just overall mental health, like how are they doing? What are their stressors and how they deal with it? And I think that's kind of like breaking down some of the root causes of why people tend to use substances. And so by focusing on both, I think it's really helpful because it creates a good communication with your provider. There's always like non-judgment here. We're here to like help and like meet the person where they're at. So it's nice to have that conversation with someone and being able to refer to someone like Dr. Belani, who's like a specialist in this field, if they need additional help. So as long as someone comes to care, I mean, we're willing to like break it down from all sorts of perspectives and just kind of seeing where that person is. And I think every woman is a little bit different in how they respond to the stressors in life and everything. And so, yeah, just coming in to seek care is like probably the best first step you can do.
Right. And I think that segues nicely into one of my next questions, which is speaking to the relationship between alcohol, anxiety, and depression. I know for many it's a coping mechanism, but it's kind of one of those chicken and egg situations of which is influencing which.
Yeah, I think that's exactly it. It's this vicious cycle. And so, kind of plainly, anxiety or depression are around, they're present. We want to identify that. We want to seek help for those. Alcohol, other substances can also often be used as a form of self-medication to alleviate the anxiety, to kind of forget about the depression. But again, a slippery slope. Alcohol is itself a depressant. And so it can kind of perpetuate the anxiety, can even magnify the anxiety. It can definitely lead to worse feelings of depression. And so if alcohol is being used to kind of alleviate anxiety and depression, then it's definitely, we start to worry about that making anxiety and depression worse, and then making the alcohol use excessive and then possibly worse. And so they can both feed into each other.
I think we're able to refer patients to help with some mental health issues too. So either you see your OBGYN and they can do that for you, or even your primary care, I think is just a good first step to seek help.
All right, awesome. Maybe as a final thought, you guys can share like one last piece of advice for women who are looking to improve their health and maybe cut back on drinking. If you have any tips that you guys have used yourself, anything that you've seen work really well.
I don't know. I always make sure that I eat before I drink. Drink lots of water. But it's about that mindfulness that you guys describe a lot on your platform. And I think it's really important not to vilify alcohol, but just to be really thoughtful about how we do it, when we do it, who we do it with, and just to be safe. And I think that's like the most important thing.
Yeah, I'll echo that. Setting goals, making sure you're keeping track of your level, your limits, and your personal tolerance. I have an ad hoc rule, 6-1-1, no more than 6 drinks in a week, or depending on what your level is, 1 drink an hour, 1 glass of water in between each drink, just to kind of stay hydrated and keep the levels moderate.
Awesome. As an ending thought, what are some of your favorite, both alcoholic and non-alcoholic drinks for when you guys are enjoying drinking mindfully?
I love mezcal, so that's my drink of choice, and in any way you want to put that in. But I'm also really big on green juice. So like anything with green juice powder, green juice blends, like those are my pretty much go-to.
Yeah, and my wife was pregnant the beginning of spring and early part of summer is spritz season. And spritzes are something you can do both non-alcoholic and alcoholic. And so currently my spritz is a strawberry French 75 because the fresh strawberries. Which you can do without gin or champagne, or you can use non-alcoholic versions of gin and any versions of sparkling wine to make a good French 75. Yeah.
Good choices.
Yeah, thanks for having us.
Yeah, thanks so much. This was great. Thanks, Dr. Celaya, for joining.
Yeah, thanks really for the invite.
As a woman, it's important to stay mindful of your drinking habits. Sunnyside can help you build better drinking habits so you can still have fun without overdoing it. Just head to sunnyside.co and take our 3-minute quiz so that you can start building your personalized plan. Check out the link in the description to get started. And of course, if you found this video helpful, leave us a like and a comment, and don't forget to subscribe. Be sure to check out the Sunnyside blog for more helpful tips on alcohol health and on how to become a more mindful drinker. Don't forget to sign up for our newsletter as well. Thanks for watching, and I'll see you next time.